You are watching the DocTalk show.
Welcome back. Abortions in Uganda are among the leading cause of maternal deaths. In the previous segment, we found out that majority of the abortions occur in pregnancies that are unintended. And when you have an unintended pregnancy, you're likely to have an induced abortion. So what factors can contribute to these unintended? Dr. Mugisha, do you want to highlight some of these factors?
I could try to demystify that, yes. So spontaneous miscarriages could be caused by a number of factors, majority of which are going to occur within the first 3 months, which we call the first trimester. And we usually want to classify them into either caused by the fetus itself or the maternal conditions at the start. So majority of these miscarriages, which are over 50%, are going to occur because the fetus had some abnormalities in its formation. Abnormalities that render it unable to survive once either development or even after delivery. So mostly caused by chromosomes as in its development, either from the father or maternal genes. Sometimes it gives them incompatible abnormalities to life. So as in and as of itself, you can look at it as if it's a law of survival. So they might not survive because they actually have these major significant abnormalities. So other causes, more so from the maternal side, some mothers have some comorbidities, some illnesses. They could have diabetes has been implicated. They could have some issues with their reproductive organs. Say the uterus is abnormally formed all through childhood and they hadn't really noticed it until these recurrent miscarriages. They could have abnormalities to do with the opening into the cervix, into the womb, which we call the cervix. Could be either too loose to support any pregnancy for too long. And all these abnormalities will ultimately lead into a loss of the pregnancy. Okay. Other known causes like infections could come through.
I think we should also emphasize infections because we live in a country where infections are still the dominant cause of disease. Infections such as malaria, we all know can result in loss of pregnancies. So I think it's important to emphasize the need to screen for these infections. Could there be any other infections that also result in loss of pregnancies?
So apart from malaria, we can have urinary tract infections, and any other bacterial, viral, any other infection that
like STIs, chlamydia, hugely implicated.
So infections during antenatal care, whether malaria or urinary tract infections, or you mentioned gene problems, that means the baby's development makes it not able to survive. You also mentioned factors such as diabetes or high blood pressure, or structures, issues related to the woman's womb. Maybe it has fibroids or it has like a loose
developmental
abnormalities
or a loose cervix.
So all these can contribute to an unintended loss of the pregnancy. So I want to discuss more about these induced abortions, these intended abortions. What are the dangers if you want to induce an abortion on yourself? Sometimes abortions can occur spontaneously, but in majority of cases, they're often intended. So I'll start with maybe Dr. Andaziri. These intended abortions, what is the danger around them?
So in countries where the laws around abortion are a little bit restrictive and vague, like in Uganda, most women are likely to go in places which are clandestine, they're hiding, to make sure they get this abortion because they don't want this pregnancy. Yeah, so most of those abortions are likely to be unsafe because one, the methods they use in those places, they are more likely not to sterilize the equipment that they're going to use. Some people use sticks, others use hangers, to make sure they start some bleeding, okay? Other people use trauma, just the hit their tummies to make sure, they can start bleeding. Those make this kind of abortion unsafe, okay? besides the skills of these people who are carrying out these kinds of abortion, is also wanting. They are not well trained to manage the complications that surround the abortion. Okay. So that, and 90%, 98% of these are happening in countries where the laws are not clear. The laws about abortion are not clear.
Or you mean where
Sub-Saharan Africa,
where the laws do not allow abortion
exactly
to occur in the legal context?
Yeah, they do
Majority
not.
of the cases would be unsafe.
Yes.
Unsafe abortion.
Yes.
Okay, and then you describe, you highlighted 3 factors. You said the environment not being safe for the procedure. It may be done in someone's garage or in some environment which you don't understand, which is unclean, maybe dusty, and then it poses the risk of the infection. The second you mentioned is the skills. The person carrying out the abortion may not be well trained to do it well, and then they cause further harm than good.
They cause trauma, they perforate the uterus, and you see, perforate the uterus, you can perforate the bladder, the intestines, and you know it's a whole lot of complications.
Okay, and the third one being the technique, the way it is done is wrong. So those 3 factors make it very unsafe. The poor skill of the person doing the abortion, the environment, and the way it is done. So, Dr. Mugisha, these intended abortions, we understand they cause so many complications versus the safe. The safe abortions tend to have fewer complications because they're carried out by the correct people in the safe environment with the correct procedures. So now, what are the problems that arise from the unsafe abortions? Things done under hiding by unqualified people. What could go wrong?
Yes, thank you. Of course, clandestine activities will almost always have an implication on these women's life. And as you rightfully said, majority of them will occur in countries that have restrictive laws, Uganda being very much inclusive. And so a couple of complications can come. One of the most common ones is bleeding. And that one causes, it's by far what will give you the most complications. So women bleed to various extents, but here we're talking about, profuse bleeding, which might, giving you either coagulation issues, or they might bleed out.
So it can even cause the heart to stop working.
Yeah. Might at some area give you more
because they've lost too much blood, like liters and liters of blood. Then the blood is so little and they become anemic when the blood loss was too big and the volume of blood in the body is so little, so it can't pump. The heart fails to work eventually.
So more often than not, we really see mostly exsanguinated women, come with literally no blood then. And they really need urgent blood transfusion at the time. In our country right now, I think you saw recently, with our blood shortages in the country. So
those are compounded issues.
Yes,
we may not be in the state to handle now the emergency of the shortage of blood.
The shortages of blood.
You have a mother who had an intended abortion and is bleeding profusely. So that's really a very tricky situation. It shows the impact of what the abortion can do to the mother. It may be either an issue of a facility or shortage of a resource, or the disease itself coming from the excessive bleeding. Could there be any other complications?
So unsafe abortions can also give you an immense array of infections, most likely due to retain. So because, as Dr. Junior had said, these are unskilled people who, they don't have the right techniques to actually do. More often we see tissues remain inside. It's not so exhaustive, evacuation of some of these products or whatever they intend to do. It is incompletely done, and the retained products tend to get infected over time. So they come in with features, a lot of fever, a lot of abdominal pains, discharge, a foul odor, stupor of sorts. So all these come through with infections, and they take long to actually seek the care they do, because they'll most likely go back to this person who will not, come out so openly and say, maybe this is what probably caused it due to my inefficiencies, give them all sorts of drugs they can, you know, and come to us quite late.
Can
So
these
yes.
infections cause death? Are they a big
Oh
problem?
yes, yes. Huge, huge, huge. Yeah, when we say deaths due to unsafe abortions, mostly due to bleeding and sepsis from these infections, yes.
Okay, so those are the two biggest killers if someone has an intended abortion. They'll probably die from excessive bleeding or from infections. And the infections arise because the person either used a poor technique or used very unclean instruments or something went wrong. So remember, you can always send in your questions, your comments on the social media platforms. You can check out our videos on the YouTube page, that is the DocTalk show, in case you have missed some of these shows. And just after the break, we shall come back and discuss more about how to prevent abortion in the first place. Because every disease, every illness has a prevention measure. Okay, and we always know prevention is far better than cure. Managing an abortion itself is very difficult. The easiest way is to prevent it. So after the break, we shall talk more about prevention.
You are watching the DocTalk Show.